This is From Destruction to Dignity with Janice Pons. Each week, Janice shares her wisdom to enlighten, educate, and advance the culture in America today. Janice Pons is a mother, author, and free thinker, and your host for our podcast this evening. Now let's join your host, Janice Pons.
Greetings, greetings, greetings. Come on in. Come on in. Welcome, welcome, welcome. I am so glad that you are here. My name is Janice Pons. I am your host on this show. This is our show because we gather together, and I'm so appreciative of you coming every week to just, we talk, we discuss, we go there, and we provoke thought, we bring awareness, and we point people towards intervention on this show, which is From Destruction to Dignity, clinical perspectives, spiritual truths, because there are truly destructive patterns going on all around us. But you know what? The God that I serve has a pathway of dignity. And that's my heart. Because what I find is that when we provoke thought, bring awareness, and point people towards intervention, people, they go, if you could see some of the testimonies that I get, just messages saying, thank you so much. I never understood narcissism. I didn't understand the stages of addiction. I didn't understand about the spiritual abuse. I just didn't understand. Thank you for talking about it and provoking my thoughts. And a lot of people said they just started doing some research and reading for themselves and found out more information and found out how they could get intervention. Yes, to God be the glory. I'm happy about that. So, having said that, in terms of destructive patterns going into dignity, I'm going to dive in tonight because there is a serious issue going on in our society, and it involves marijuana, cannabis. Here in Tulsa, Oklahoma, in the month of March, we had a vote. We have medical marijuana that is legal here, but some people signed a petition to get on the ballot for us to decide if we wanted to have recreational. We already have medical. People have a constitutional right to have these entities set up, medical marijuana. There are many reports of benefits, but we're not talking about medical marijuana. Medical cannabis. We're not talking about recreational necessarily, because in Oklahoma, 62% of us said no. I think it was March 7th. It was in March. It was like, we don't want it. We don't want it. And I'm getting ready to share with you tonight why we didn't want it. Yeah. And I've had, when I posted on my social media page, I had some strange people that don't know Janice Pons try to jump in and say, where you getting your information from? Yahoo Answers? No, baby, I do research, and I am a clinician, but Janice, as the clinician that specializes in addiction and mental health, addiction is my passion. This is about education. This isn't about Janice, the clinician, but we do educate, and there are some principles that are a part of that education process. So that's what we do on here. So tonight, we're going to look at something that is really serious in our society, because young people are smoking marijuana left and right, and some of them don't have a clue what they have gotten a hold of. And so tonight we're going to look at identifying cannabis-induced psychosis. Cannabis-induced psychosis. Boy, how many conversations have I had where people were trying to back me in a corner? I say, bring it on. Bring it on. Because emotions really, this is not what it's about. It's about facts and about can marijuana cause psychosis? And I hear people say, there you go again. You don't know what you're talking about. Well, let's go there. Let's go there. Dr. Karen Randall, of course, this is fair use. Dr. Karen Randall, D.O., she shared recently that she treated a patient, and it was the youngest patient that she had ever treated, who had CIP, Cannabis-Induced Psychosis. Guess how old the child was? 7. So she spoke, and I've read different accounts, just serious stuff that people want to downplay and say, oh, that y'all making that stuff up. No, we're not. No, we're not. She reported hearing the screams, the yelling, uncontrollable rage from a 7-year-old. Dr. Randall is an emergency medicine physician at Southern Colorado Emergency Medicine Associates. It's a group practice in Pueblo, Colorado. Now, what does she do? What's her specialty? She's like, I love working with addicts and alcoholics and addiction and those that have brain injuries, just the whole 9 yards of these presentations that people have when they have these challenges. So what Dr. Randall does, she treats youth for cannabis-related medical problems in the emergency department an average of 2 or 3 times a shift. So people say, stop right there, because see, what she does, and here's a doctor, and people say, well, what do you tell you? There you got something off Yahoo Answers. You don't know marijuana, cannabis doesn't cause any kind of problems. Stick with me. So she treats youth for cannabis-related medical problems. We did a show here recently on, does it affect the damaging effects of smoking it? So, see, let's frame this even more. Colorado legalized recreational use of cannabis for adults 21 and older back in 2012. So Dr. Randall said that she had noticed an uptick in cannabis use since that happened. Hello, don't we expect that? As well as, here's what the other uptick happened in, cannabis-induced psychosis. Now, what is that? Cannabis-induced psychosis. It's a syndrome that can be indistinguishably, it's different from other psychiatric disorders such as schizophrenia. Now, it can have the same type of presentation. I've dealt with people that were diagnosed with schizophrenia. And one of my dear colleagues taught me this years ago. You never said, well, he's schizophrenic. No. He said, they are a person that is dealing with a diagnosis of schizophrenia. The two conditions require different approaches to care for. Cannabis-induced psychosis, schizophrenia, they can look just alike. I've dealt with people who were diagnosed with schizophrenia. Whoa. A lot of times you can't differentiate it unless you know the patient. Listen to these numbers. In 2019, 37% of high school students in this nation reported ever using marijuana. 37%. Let's run it on up to 40. 22% reported using in the last 30 days, and the rates remained steady in 2020 as we progressed in the years following increases in 2018 and 2019. This is according to the Centers for Disease Control and Prevention. Now, the CDC, Center for Disease Control and Prevention, also found that 8% of 8th graders, 19% of 10th graders, and 22% of 12th graders reported vaping marijuana within the last year. 2022 coming up to now. Now, clinicians, trained, skilled people, in states where recreational marijuana has been legalized, said that they have noticed a huge increase in young patients with psychiatric problems, especially after the consumption of cannabis products in high doses. Nah, but it doesn't cause a problem. Smoking weed, y'all just tripping. Keep your seatbelt on, precious. Keep it on. And as a matter of fact, tighten it up. Tighten it up. Cannabis-induced psychosis, it can be tricky to distinguish from other psychoses of other causes, such as bipolar disorder with psychotic features. I've seen that many times. And schizophrenia, which I've seen many times. I've worked in psychiatric hospitals, and you see everything. So with these adolescents, they're showing up with these presentations of full-blown psychosis. Now, how can you differentiate it? Because, listen, why is this important for us to be talking about it? Because they out there smoking this strong weed. They are smoking marijuana, cannabis. It is laden with tetrahydrocannabinol, THC. How do you differentiate CIP, cannabis-induced psychosis, from schizophrenia or bipolar disorder with psychotic features? It's important to know, because this is the presentation that's showing up in different places like schools, churches, out on the corner, in Quick Trip, in the stores, the come and goes. They're out there everywhere. And so you see these presentations, and so what do? Ignore it? That's somebody's child. So let's look at this. Cannabis-induced psychosis is characterized by delusions. They believe things that are simply not true, and it is locked. It is a delusional set that gets locked into their mind, and you can't talk them out of it. And you're looking at them and going, wow. But they believe it. And they'll fight you over that delusion, physically fight you over it. So it's characterized, substance-induced cannabis, which is a substance, cannabis-induced psychosis is characterized by delusions and hallucinations. They're seeing things and hearing things that other people don't hear or see. I've seen people having full-blown hallucinations, and they can have command hallucinations. Command means those voices, what they're hearing, they hear voices, and they are commanding them to do certain things, like kill that person or jump off of that building. Command. It's not just hearing noises, and I can tell when they're responding to internal stimuli or either external. That's the term we use. They were responding to stimuli. They start looking under, they hearing, y'all hear that down there? You. I've had people sitting in front of me and just go, whoo! And I said, what happened? He said, did you see that big black thing flying here? I said, sweetheart, no. I didn't see it, but I believe you did. Thank you. I'm not crazy, they may say. Whew. This thing gets serious. So, cannabis-induced psychosis, where they're having these types of symptoms, are characterized by delusions, hallucinations, hearing things and seeing things that other people don't hear or see, caused by marijuana. And sometimes anxiety, intense anxiety, disorganized thoughts, paranoia, being totally overwhelmed, taken over by fear, intense paranoia, disassociations, They're out of their bodies, and changes in mood and behavior. Do you think we need to be aware of this? Recreational marijuana. We already did a show about the ingestible cannabis. These kids getting a hold of chocolate, these babies, 3 years old, getting a hold of milk chocolate, and it's loaded with THC. Remember the purple panty eater? That dark chocolate, loaded with THC. And these babies are getting a hold to them. 3 toddlers are taking it, and the parent, and then they fall out, and they're exhibiting all these symptoms, and they end up interacting with the poison control center, going to the emergency room. Some of them end up in seizures. It just can get way out of hand. So, cannabis-induced psychosis, these symptoms can last for a couple of hours. They might not require any specific treatment, although these symptoms can persist depending upon a person's tolerance and the dose of THC. Tolerance, everybody's body weight, their chemical makeup is different. So, a diagnosis of it requires gathering information about any previously specified diagnosis, such as a bipolar disorder or schizophrenia. Whether someone took medication for those diagnoses, whether there's a family history of mental illness. Sometimes people have psychotic breaks. With schizophrenia, often it's in their early 20s. It just is. Whether the person recently started using marijuana for the first time. In some cases, marijuana can exacerbate mental illness, symptoms of mental illness, or it just unmasks it. You know why? It triggers a specific part of the brain. I have seen 2 people in my career that they got a hold to laced drugs, and when you get high, it flips a switch in your brain. The dopamine is released. You're in this euphoria. Hopefully the switch comes back down. You sleep it off, it wears off. I've seen 2 people, they were in full-blown psychosis. The switch never came down. It never came back. It never went off. And so they were just in paranoia the rest of their life. All triggered by using drugs. Now, one of them, it was methamphetamine. It puts holes in your brain. So, if the symptoms of cannabis-induced psychosis, if it resolves, and usually they do, clinicians can recommend patients abstain from it going forward, and it really is no other need to treat it. But when they have that kind of experience, it can be earth-shattering. Maybe some of them might go, you know what, I'm done. I'm done, because you don't know if it's going to happen again. So, with the limited information that a clinician can have the first couple of days when they have someone come into them with these presentations, a lot of times they err on the side of safety. They're trying to figure out, is this a mental health situation, or is it substance-induced? Cannabis-induced psychosis. So psychosis is a combination of symptoms, delusions, hallucinations, disorganized behavior, but it is not a disorder in itself. It can be a symptom of schizophrenia. It can be symptoms of a chronic psychiatric illness, but cannabis-induced psychosis can look just like schizophrenia. But schizophrenia can be diagnosed only after a patient with signs of a disturbance. It has to go for at least 6 months. It can't be diagnosed. It has to go for at least 6 months, according to the DSM-5, Diagnostic and Statistical Manual of Mental Disorders. And it can't be just one interaction. You have to observe this over a period of time. You have to look at age. There's many factors. This isn't about diagnosing, but it's important because people make mistakes and think it's something that it's not. Now, if a person says that they've recently started using marijuana and have been previously diagnosed with a bipolar disorder or schizophrenia, a lot of times a doctor may prescribe medications such as lithium or quetiapine. I know of somebody recently, they started taking lithium. They had a brain injury. When the brain is injured, it's just like sometimes they just need medication to come in there and help it. It gets injured. It's not going to operate the way it's supposed to outside of a miracle. And that person got lithium and they totally cleared. Oh, wow. That was interesting. But their thought patterns cleared up. That mood variability, the irritability, it just cleared it up. Interesting, huh? Cannabis can result in people that have mental health issues needing higher doses of medication than they took. Listen, here's the bottom line. The cannabis goes in there and affects the brain. It affects the chemicals, and a person's functioning is going to be severely impaired at times. Now, let's look at something. Here's something that's going on in our society, because I've had people say, there y'all go again, talking about weed is harmful. And it can lead to psychosis. Yes, it can. And it can lead to suicide. There is a dangerous type of marijuana that's out there. It's called dabbing. D-A-B-B-I-N-G, dabbing. It's a dangerous type of marijuana use that has become more common in recent years. While the use of marijuana use in teens has increased significantly, particularly with recreational marijuana, the new trend is taking marijuana use to an entirely other level. We need to know about dabbing, D-A-B-B-I-N-G. It involves using cannabis extracts with higher levels. What is dabbing? Dabbing is using dabs or marijuana concentrates. Dabbing creates a higher, stronger level of the active ingredient in marijuana. So normally in a joint, it would be about 20% THC. With dabbing, it's 80%. Oh, God. Listen, put up that visual. Let's put up that visual. I want to capture something here. These are the stages of addiction. I've referred to it many times. But listen, marijuana is very addictive. Marijuana can be very dangerous. They're lying to you when they tell you it doesn't. Dabbing, these kids don't know what they're getting into. There's marijuana that's been laced with fentanyl. Yes, it has been. And this is how kids are ending up dead, because they end up smoking a marijuana-laced fentanyl. It's happened. It's happened. I shared that before. It's happened in South Carolina. It's happened. It's in marijuana. Someone died here in Tulsa about 2 months ago, getting a hold to marijuana-laced fentanyl-laced marijuana. So that stages of addiction there, listen, everybody that's using is in that bell-shaped curve. We have on one side, see, I want to know quickly as a clinician, I do want to know frequency, intensity, duration. How often are you using? How much are you using? And how long has it gone on? I can pretty much tell in less than 60 seconds where they're at in the stage of addiction based on frequency, intensity, duration. You see them on the side there. Now, that early stage addiction, recreational, we just smoking a joint every now and then. No big deal. It's early stages recreational use. But they continue. And when they get this 80% of THC in their system, they get addicted to using high levels of marijuana. The 20% won't cut it. So they end up being enthralled in middle stage addiction, substance abuse. They're abusing it. It's no longer recreational. That middle stage is they're driven by addictive thinking, which equals addictive behavior, which equals insanity. And we know that insanity means we're doing the same thing over and over again, but we really are expecting different results, but you won't get it because it will continue. It will continue. It will continue. And so addictive thinking, you're trying to figure out how you can get it. You're trying to figure out how you can get a hit. How can you get some money? Everything is enthralled in that. So that middle stage, because you can develop a physiological dependence to this substance, you can end up in late stage, which is substance dependence. How do you know you're there? Particularly with alcohol and other drugs, but it can also, this marijuana that's laced with all this stuff, it's tolerance. You got to have more to get the desired results. Withdrawal, because you're dependent. It's late stage. You progressively gone to this stage where you got to use to feel normal. It's loss of control. Your life's out of control. Blackouts. That particularly happens with alcohol, where you don't even remember what you did. But when you get into this psychosis thing, do you remember what you did? Do you? And then DTs. That's particularly with alcohol, delirium tremens, where you're hearing things, seeing things, the hallucinations. It just all dovetails. And then if you're drinking and combining that with weed, oh my God, 80% THC that has butane hash oil, where it has butane in it. This is what these kids are getting high off of. And body rot, your lungs will rot, your body will rot. And listen, what it's going to lead to is up there, that other visual in the blue, jail, institutions, or death. That's it. It'll kill you. Or rehab, recovery, and wellness. Everything I do through the eyes of addiction and helping people is through the eyes of what I got at the bottom of that bell-shaped curve, life or death, because it will kill you, and it's going to be sobriety or addiction, but there's always going to be this cesspool that churns, and it's going to, justification, manipulation, and rationalization will try to convince you that it's okay to go back and take one more hit. Now, let's get into a young man that lost his life, Johnny. Oh my God, Johnny and his parents. Johnny was a vibrant young man, had a 4.2 GPA, but he started using weed. And bottom line, long story short, he ended up using the 80% that had been infused with the butane. Long story short, he became psychotic. He was in and out of treatment facilities for full-blown psychosis. Full-blown psychosis. He got to a point that delusional set, believing something that's absolutely not true, and having hallucinations, and having command hallucinations, that he heard the voice to tell him, this 4.2 student, to jump off a building, and he did, and he killed himself. All related to marijuana. So when I hear people try to convince me that marijuana, it doesn't hurt you, it's a lie, it's a lie, it's a lie. Cannabis-induced psychosis is real. It's going to be jails, institutions, and death. That's where addiction takes you. Ask me how I know. I'm a clinician. It's my passion. It took my family out. And a lot of them the ones that are alive get ticked off if I say it. Deal with it. Because the ones that died told me to go there. And I will. Because if we can save one life, and I've saved many, to God be the glory, I'm going to keep talking about it. They told me to, and I will. And I count it in honor. So listen, cannabis-induced psychosis is preventable. Marijuana, smoking it, they can say what they want to say. You don't know what you're getting a hold to nowadays. Is it laced with fentanyl? Is it marijuana that has been boosted with butane? Is it the marijuana that's been treated that's going to cause you to have full-blown psychosis where you will feel like you are absolutely losing your mind? Listen, rehab, recovery, and wellness is what Janice Pons pushes. I make no excuse for it because I have seen what it does when people embrace therapy. When they embrace support systems, when they go to treatment, when they have a support group like Al-Anon, Alcoholics Anonymous, Celebrate Recovery. You have to be intentional with your recovery and wellness. Listen, there's no safe amount of getting high anymore. All of it is destruction. But what we want to empower our citizens in the Constitutional Republic of the United States and all these precious babies, these teenagers, is to choose a path of dignity. God has a plan, and it's one of dignity and freedom from addiction. God bless you. Good night.
Thanks for listening to this week's episode of From Destruction to Dignity with Janice Pons. Janice's mission is to provoke thought, bring awareness, and point people towards intervention when needed. As a reminder, this show is not therapy, but for educational purposes only. For more information, check out JanicePons.com or follow her on social media.